distinguished speakers, fellow privacy commissioners, privacy officers from the corporate sector, the president and members of the Center for Information Policy Leadership, members and observers of the Global Privacy Assembly, data protection officers, and privacy champions and advocates. Welcome to the GPA COVID-19 Taskforce CIPL collaborative webinar entitled Data Protection Reimagined, Digital Acceleration, New Emerging Issues, and the Role of Privacy Regulators in the COVID-19 Era. I want to thank the CIPL, the GPA Secretariat, and our GPA COVID-19 Task Force members for their support and dedication to organize this first collab webinar. As of August 5, a total of 18,354,342 confirmed COVID-19 cases worldwide were reported to the WHO. Worldwide, the figures are still rising. We are not out of the woods yet, and our work is still far from over. Those attending a GPA COVID-19 Task Force webinar for the first time, allow me to introduce the origins of the Task Force and its time-bound work. Established in April 2020 by the GPA Executive Committee, the GPA COVID-19 Task Force aims to unify efforts, maximize the voices, and tap the expertise of the GPA members and observers in addressing the emerging privacy issues posed by the spread of the virus worldwide. This pandemic has intensified the use and role of data, especially personal data, in analyzing and mapping the origin and spread of the virus, sharing data between and among relevant government agencies for monitoring, mitigation, and response, and serving as the basis for policies and regulations in this time of the pandemic. However, the pandemic has also shown that these responses come with associated privacy and data protection challenges and issues that data protection and privacy authorities need to address. Based on the survey conducted by the GPA COVID-19 Task Force, contact tracing and location tracking ranked as the most pressing issue of jurisdictions and organizations. As one of the new emerging challenges confronting us, contact tracing applications pose questions on proportionality and transparency requirements, privacy issues on location tracking and surveillance, and whether privacy by design approaches figured in the development of these applications. To quench the GPA members' desire for new guidance, the first Task Force initiated webinar focused on contact tracing applications. During the first event, the steps taken to safeguard users' privacy in contact tracing were tackled by technical experts from the two of the largest technology companies globally, Apple and Google. A policy discourse ensued with privacy regulators who have successfully applied for data protection by design in contact tracing apps to help members and observers whose countries are at the exploratory or decision-making stage of the process of adoption of these applications. The second webinar paved the way to discuss the privacy by design in contact tracing applications and examine the role of data protection authorities in the recovery response. In today's webinar, we will discuss the pandemic's impact on industries and privacy authorities, and how the pandemic has intensified the use and role of data to respond to the health crisis. Emerging data privacy opportunities and challenges, evolving roles of authorities and industries, and shifting regulatory priorities will be tackled. As enablers and protectors, let us continue to protect our data subjects. We can help prevent personal data misuse by ensuring that personal data processed in the name of the COVID response will only be processed solely for addressing the pandemic. And we should be holding authorities and other authorized controllers accountable as they use this data for treatment, disease surveillance, and response. Public trust is vital in effectively rolling out contact tracing mechanisms and other digital solutions. But trust will only happen if our citizens are convinced that their data is processed fairly, lawfully, and securely. We do not have to learn only the technical functionality of contact tracing technologies, but we must also understand its effectiveness and impact on our data subjects. We must let them know that we are their guide in all matters related to data privacy and data protection, that we are always tuned in for local and international privacy-related developments, that we are here to provide them with the most relevant bulletins, guidelines, and best practices for emerging data privacy concerns. Our data subjects need us now more than ever. Our roles as data protection authorities are significant in protecting individuals' personal information and fostering privacy rights, especially during this time. These are the realities that we face today. Data privacy challenges will increase unprecedentedly, but we must help one another to overcome this. We are all here to create knowledge and share best practices as a global community. But most importantly, we are all here now to develop the confidence to declare to our governments and citizens that public health and personal data protection and privacy are on the same side in this time of a pandemic. Thank you. And let me turn you over now to Boyana Bellamy of CIPL to kick off the discussions.
Thank you very much for your leadership on the Data Global Privacy Assembly Task Force. It is incredibly important that we actually deal with this global crisis in a global and connected way. And we are really grateful to you and the Global Privacy Assembly for setting this up. And of course, thanks everybody for joining us for this very special webinar. I know there are many COVID webinars, but this is different. And as Commissioner Libora has said, it is different because we have managed to get a great group of people to speak to you, but also a great group of people to listen and to participate and ask questions. So we have this great mix of privacy regulators, policymakers, business and privacy leaders, and of course, academic and other NGOs and some journalists as well, if I'm correct. So I would just like to give you a few reflections on the work that we at CIPL have been doing since the beginning of this crisis. And CIPL is always thinking forward and thinking ahead. So we took the opportunity to look at the crisis and think, how is this going to change the world ahead for all of us? And what is this going to look like in the months and probably years post-COVID, post-immediate pandemic threats? We produced this paper, which is called Looking Beyond COVID. It's on our website. It's free to everybody, and we have circulated it with data protection regulators and have had a number of discussions with our business leaders and CIPL members as well as regulators and what they're seeing. And this webinar is really going to try to discuss some of these trends and also look forward. How do we get prepared for this new normal? And I think the impact that we have seen is really on a number of fronts. First of all, we as individuals all have been hugely impacted by this crisis. And from privacy perspective, individuals have been potentially even sharing more information than ever before. They have also curtailed their other human rights, such as freedom of movement, family life, in order to fight the pandemic. And so the question is really, are individuals also prepared to curtail or trade some of their privacy for the public safety? Or is it perhaps the way to look at this different, to say, actually, people expect both privacy and public safety and effective governments, effective regulators as well dealing with this pandemic? And of course, individuals have been living their lives online, right? From working to thinking to socializing to praying. And that, of course, has got huge implications on everybody. When it comes to organizations, we notice a number of trends. Of course, first of all organizations have lived through this huge digital transformation acceleration, and those that were not online are going to be online now. And of course, that poses in itself new privacy challenges as well. They had to literally reimagine the way they work, the way they operate, the way they serve their customers, from remote working to health and safety issues, to ensuring well-being of their people. They had to also deliver new processes, new business models as well. And we have new companies, new disruptors, and we are using Zoom. Well, Zoom has had a huge rise in this pandemic. But then some companies that we've never heard of have become really important players in this new ecosystem of fighting COVID because they have got this special technology or special skills to be able to deliver services to the government or wider society. And of course, companies are using more data for good, and we're going to hear as well from our speakers from industry today some of their examples, because their employees have been pushing them and sort of saying, what is the role of our organization and company? How can we actually help this pandemic, right? And even investors have been doing the same. And there has been increased call for data sharing and for using data to fight the pandemic and in new innovative ways, and sharing this data between different public and private sector organizations and between different private sector organizations, right? And Google and Apple partnership is just a point in that as well. And of course, with that came new challenges for organizations who had to not only ensure data privacy and data protection compliance with these new things, but also data security. We have seen increased cybersecurity threats as a result of COVID. Some of the commentators talk about in financial services in the first 2 months, 280% increase in cyber threats. So companies had to do more in order to protect their systems, in order to protect their data, to protect their intellectual property. So more monitoring potentially, more checking and assessing what happens on their networks as well. And again, that raises privacy considerations as well. And of course, with all of that, acceleration and use of AI, comes also what I think acceleration in privacy as well. I think we have seen the best companies, those who we work at CIPL, and you're going to hear some of them speak, how they have stepped up their privacy compliance and privacy responsibility. And ultimately, it does boil down to organizational accountability. I know some people have been predicting the death of privacy. They were saying this is just like 9/11, where security overrid privacy. But I actually think this is the moment where we are realizing that we need to achieve both. One, use of data, sharing and collection of data for combating this pandemic and for public health and for reopening and reboosting our societies and economy. But also at the same time, we have to do it in a way that is responsible, accountable, and protects people's privacy and builds trust in that system. And that is why we at CIPL, very early on in the pandemic, when media was crying, we are sacrificing privacy for health, I really felt very strongly saying that's absolutely not right. We have to do both. And we issued this op-ed that is also available on our website, where we put 12 steps that organizations can put in place to ensure accountable data sharing. And when I say organizations, by all means, I mean governments as well, right? We need governments to be accountable and also to use data responsibly. And so finally, let me kind of say something around some of the trends we are observing on the data protection regulator side. And of course, this is about a webinar with regulators. It was interesting to see how regulators were very much having this trend and reaction of staying within their nation state and dealing with this nationally. But it's great to see these attempts to actually do more convergence and guidance and thinking that is beyond just nation state. I think that's going to be very welcome, and we really encourage that. It's been excellent to see some of data protection regulators shifting their priorities, shifting their strategies, reissuing new public, transparent policies on what their priorities will be in this COVID era. Also, how they ensure this dual goal of ensuring public health, ensuring reopening of the economy, as well as protecting data. And that has been very welcome indeed. And of course, there has been some shift in enforcement priorities as well, and that's again very normal. And I think one thing that we kind of felt was we really needed data protection authorities to understand this new reality, this new changed world, right? And that's why today we're talking about data protection reimagined, because we do believe that we will have to reimagine how we organizations deliver privacy compliance, how regulators supervise, enforce, and oversee. We would like regulators to be more brave, courageous in the way they interpret the laws, to enable use of aggregate data, to enable multiple use of legal bases, to enable use of data for scientific research and AI analytics. We would like them to be more innovative, to use toolkits such as a regulatory sandbox. Maybe that would have been helpful in this crisis, and some other ones as they look at these important public-private projects that involve use of personal data. And we would like them to promote this accountable data sharing, not to stop it, but to promote it, because that also sends the right messages out there into the industry, to the governments, to the research community, that in fact it's okay to share data, but we must do it responsibly. So that is really what we kind of wrote in this paper, and this is what we would like to talk about today. How do we make sure that we understand this new world where there is an increased appetite for data, increased belief in technology solving things, but it can't be done without people, processes, accountability, and everybody's commitment to do better. And I do really hope that we will have organizations and governments stepping up. And I think the role of data protection regulators has to be to encourage that movement, right? Do the nudge theory, behavioral economics, and in fact, get all of these players and stakeholders to behave optimally. So with that, I'm now going to officially kick off our program for today. And I'm really delighted. We have a wonderful start of the webinar with Dr. Caroline Buckley, who is Associate Professor of Epidemiology at Harvard, has done huge amounts of work on researching public health responses and crises in the world from all over the place. When you look at her bio, she has been everywhere, she has done everything, and is an amazing person as well, an amazing woman. Very delighted. MIT has chosen her as one of the 35 innovators under 35, and she was CNN's top thinker and Foreign Policy magazine Global Thinker as well. So Caroline, we are delighted that you have found time to be with us. I have had a chance to hear you speak before, and I think what you have to say is incredibly important. Please shed some light on your world of using data for public good and public health. How can that be done responsibly? And in particular, what do you expect from us, privacy community, privacy regulators, and privacy officers in these major companies, so that we can help you do your work better, because your work is hugely important. So thank you. Over to you.
Thank you. Good morning, everyone. Thank you for having me. So just by way of background, I've been working in this space of using digital data to understand epidemics for over 10 years now. Most of my work is focused on vulnerable populations in low and middle income settings. And today I'm going to just touch on how that scientific process has been working until the pandemic. And then I'm going to talk about really the sea change that we've seen with respect to this kind of data in the last 6 months. I think that we're going to be entering a new era when personal location data is considered a legitimate public health data stream. And I think there are some concerns around privacy and regulation with respect to that data. Next slide, please. Okay, so this is how it has been working up until 2020. And this has been a very slow process, a very laborious process in many ways. And one of the things I want to highlight today is the fact that there's this notion that with a big data science team and enough so-called big data, you will be able to solve some of these social and public health problems. And the fact is that that's not true. You have to have a specific question and you have to know how to answer it in a way that provides insights for policymakers. And those are very different things. So in the past, the role that academia and analytics has played is in connecting private data from industry to public health questions and to operational settings. So I've worked for many years with national control programs of various kinds, mainly malaria, and in collaboration with mobile operators. Next. So the way that we work, right, we take raw data of some kind, and this is location data that's collected passively without consent. And so in the context of mobile operators, this is call detail records, CDRs. These are collected routinely and they are analyzed for churn and things like that within the operator. But we can take that data, and I'll explain how later, and turn that into something like a risk map. So we use the data in the context of the epidemiological information we have, and we put that into models to understand, for example, the role of mobility and migration in spreading disease from one place to another. We translate that into a risk map that control programs can use to allocate resources or make decisions that they need to make. That process of turning raw data into actionable insight is actually a complex one and still nascent. Next. Now, the frameworks that we have had in place that control the use of that private data and how it flows towards government agencies. First of all, mobile operators are beholden to national regulators, and that's a very important component of how this data is controlled. And then there are individual data use agreements between the mobile operator and the academics, for example. And then, of course, academic research is always conducted in the context of institutional review boards, or IRB. Next. Now, the Ministry of Telecommunications is usually involved to some extent with the national regulator, although it can be independent. Next. And for any international public health study, you also need national ethical approval. And of course, the public health department that will be doing operations sits within the Ministry of Health. So there have been these slightly clunky arrangements to get data, to use it properly, and then to transfer it into a public health department in the past. And that's been a slow process that's involved multiple levels of regulation and multiple kind of ethical steps to work. And sometimes that's been hindering what we can do with this data. Next. Next. Okay, so what has happened in the last 6 months with COVID is that we've seen an absolute flooding of policymakers and the world really with new kinds of data, not just CDR from mobile operators, but also things like, credit card transaction data. There's a whole burgeoning industry of ad tech data from smartphones and apps on your smartphones that are starting to be generated and shared. And there's the problem here is that these stringent controls that led into the flow of data to public health departments have now been bypassed in many ways by some companies. And we're seeing public health departments being absolutely deluged with different kinds of digital data. Most of the time, people within public health agencies don't really know how to make use of this data and don't really understand both the data quality and processing steps that are required to make this either useful or safe. Next. And so you will have seen many dashboards that are freely available online. Apple has one, Google has one, multiple ad tech type data is being used for different kinds of mobility and location data that are now available everywhere. The extent to which these are aggregated varies, and the quality of the data is very heterogeneous. As of yet, there are no systematic metrics that are used. Uncertainty, data representativeness is not routinely shown. And this is really changing the landscape of what we think of as public health data. In my experience, it's also been very hard for policymakers to make sense of what the data is telling them and how they can actually use it to make decisions. And I should contrast this kind of data. This is passively observed data from mobile phones with contact tracing, which you may have heard about before. Contact tracing is a whole different kind of regulatory space and a different kind of implementation. Next. So I think it's important to distinguish between the kinds of data that are available now and what they're actually used for. So CDRs, mobile phone data that I was talking about before, they can come from any kind of handset. So they're usually much more representative, especially in low and middle income countries. And CDRs are often in the form of discrete data where as you use your phone, the things that you do on your phone, send a text or whatever, that's associated with a cell tower ID. And that ID, if you know the latitude and longitude, can give you an approximate location for the user at that time. So as the user moves through their day, we can interpolate movement patterns across some kind of grid. And then we aggregate that data, and the national regulator is usually very stringent about how that aggregation is done to ensure that people are not re-identified. And we're not just talking about hashing mobile phone numbers, but in addition, making sure that the individual user can't be re-identified algorithmically either. So then in the last couple of years, we've also seen actors like Facebook and Google start to share these more continuous data streams from their apps. And this is much more granular, but again, the aggregation and the safety and stuff like that takes place within the company itself. So the Facebook Data for Good program, which is what we work with a lot, they have a whole team that works with academics to figure out how to do the aggregation safely. And then they share specific research products, matrices of movement between places that can be used by researchers. Next. And then now we have the burgeoning ad tech industry. So you don't need to worry too much about this slide, except to say that there are multiple companies that kind of gatekeep the data and what it is, how representative it is, what data quality and so on, between the human behavior and the possible metrics that you're getting out that might be used for public health. So ad tech is not the same as CDR in the sense that it's not really a longitudinal sample of people moving around, but rather it's active users that drop on and off, and almost never are you given the denominator. So how many actual people does this represent? And you have the publisher, and then that data is pre-processed and packaged, sold to a provider, and then often packaged again and sold to an aggregator. So this is people like SafeGraph and so on. And then they create metrics. This whole process is very opaque, likely very poorly representative in some places. And I think this is where we're having some of this Wild West, not really sure what the regulation is around these guys. Next. So just to explain what I've been doing in this space. So we've been together with a colleague at Direct Relief and an emergency medicine physician, Sachit Balsari. We have pulled together a conglomerate of 60 researchers. We have DUAs with multiple data providers, and we have direct one-on-one contacts through this network of academics with local and state policymakers in the States, and then internationally as well. This map is outdated. We have a lot of contacts around the world. And the idea is that we're trying to provide daily or weekly information about mobility on a level that's actually useful for policymakers. So it's an iterative process where we talk to policymakers, we try and understand what they need, and then we do a whole bunch of analytics to combine this data in a way that makes sense and provides them with what they actually need to know. Next. And I just want to acknowledge my wonderful PhD student, Nishant Kishore, who's been doing a lot of this work. Next slide. Okay, so the types of insights that we can use this data to provide, this is actually from Facebook's Data for Good. It's on our website. You can see this is county level data from Florida and Texas, for example, from a couple of days ago. What you can see with this kind of data is aggregate metrics compared to a baseline. What we're looking at here is how people are moving around relative to how they did before COVID. Okay, and so you can see changes, and here we're mapping relative mobility, but it's important to remember that there are many, many metrics that you could use. Analyzing this data is not trivial, and so you know, we need to be doing systematic research on actually what it represents, because remember, these mobility metrics are ultimately proxies for epidemiologically meaningful contacts. And that link is not totally trivial to understand. And certainly there are representativeness issues, especially in rural places and in low income settings. What you can see in the last couple of days in the US, here in Florida and Texas, is that we have a lot of heterogeneity. Some people are moving a lot more, people are nearly back to normal. We've seen a gradual increase in mobility since the lockdowns in March and April. Next. We can also get quite local information. And so the granularity of these data really vary, and it's not always straightforward to understand what's happening with the epidemic if you aggregate to a large spatial scale. So a lot of this is about matching the spatial scale of your data to the epidemiology itself in order for it to be useful. Next. What we've seen almost everywhere, this is from Boston, this is from one of our situation reports that we gave to the Boston Public Health Department. This is looking at the change in the population aggregated by day. So that means how much density, how many people are sort of moving around in those neighborhoods. And what we've seen almost everywhere is an emptying out of commercial districts. So in downtown and Fenway and so on, these are places which are commercial. And we've seen a gradual emptying out of that. You'll see these weekly spikes. That's a weekend effect. Next. In contrast, in the more residential areas, of course, we haven't seen that reduction in density, and that's because, of course, people are staying home. And so this data provides you with a real-time indicator for where everybody is and how they're moving around. So very different from contact tracing data, but nevertheless insight into human behavior that drives transmission. And I think it's important to remember here that for COVID, our testing capacity has been a constant issue since the beginning of this pandemic. And that's meant that confirmed cases, almost everywhere, confirmed cases is not a very good indicator. And even when it's okay, it's still lagged with respect to the actions that produce transmission. So we have confirmed cases, test positivity, hospitalizations and deaths. All of those are imperfect and lagged indicators. So this kind of real-time insight into the behaviors that are driving transmission can tell you a lot about what's going on. And it's a very useful indicator for policymakers. You can also see anomalous behaviors. So holidays, for example, I work in Bangladesh, and Eid holiday leads to a lot of travel. You can map that, you can understand what's happening in real time, and that's helpful. Next. This just, slightly frenetic GIF shows travel out of Manhattan prior to the lockdown and then during the lockdown. And so we don't just want to know about mobility within locations to get an idea of transmission. We also want to know how things might spread out of a location and start to think about risks of importation. This is going to be particularly important in the fall as colleges and schools come back in the US, but we've seen it across the world. Actually, one of the most generalizable responses to lockdowns has been displacement of people from cities and out to the country. Next. So this is from cities in the US. We've seen a drastic reduction in the population density in urban settings. So here we've had, since this is just from March to May, and you can see Atlanta and Boston there, really an emptying out. Next. What we see is that that's very heterogeneous. So this just shows you Manhattan, and it shows you the relative change in population. You can see Manhattan's really empty, and that's because many of the people who lived there have left and gone to the countryside. In fact, this is very universal behavior. It's happened in Spain, in France, in India, in Bangladesh, in everywhere we've looked, Brazil, and so on. So there are these kind of generalizable patterns that we see from this kind of data that can help us to plan for when and if things return, and think about how risk is changing in space and time. Next. The other thing is, there's been some issue with whether it really represents the pandemic, the epidemic itself. This just shows you that commuting patterns. So this is a certain kind of data that we measure where you go one way in the morning, another way in the afternoon. It's indicative that people are working. We compared that to the prevalence of antibodies among pregnant women delivering in New York. Pregnant women are a good random sample. These are asymptomatic people with no symptoms, and they're more representative than many other ways of sampling. Next. And what you can see if you compare neighborhood prevalence of people with antibodies to commuting patterns in particular, you see a very strong relationship where at places where we had massive declines in commuting, we've seen very low spread of the virus. And in places where people have continued to commute, we've seen relatively high prevalence. You can see quite high prevalence in parts of New York. And again, this brings up this issue that we're not just measuring, we're not just thinking about individual privacy, but also community privacy. The people that have been unable to social distance are basically poor people who can't afford to stop working, or they're essential workers. And so the virus has really hit those populations hardest, and we need to think about that when we think about differential privacy algorithms and so on for group privacy, not just individual privacy. Next. So the data itself is not trivial, and we still don't understand exactly how to do this well or how it relates to the spread of the virus. So this is not a straightforward kind of analysis. One of the things that our network does is try to standardize measures, come up with mathematical descriptions of uncertainty that policymakers can, that we can use to help communicate to policymakers what to trust, how to think about this data. And one concern is that we've seen a lot of companies put out their own metrics and models. And of course, the rise of the armchair epidemiologist has been astonishing in the last 6 months. But you know, you can't come into this field as a novice data scientist and instantly understand how to make this into a public health insight. And I think that's really important. Some of the big issues with respect to the actual data itself are representativeness, of course. And there's a tension there between privacy, where we don't want every demographic detail about individuals because that starts to come into problematic territory. But equally, we need to understand something about how representative this data is, just as we would any other kind of public health data. Baselines, maybe this is technical, but you know, you need to understand what's happened in the past. This is true when we're looking at things like excess mortality and what we can attribute to COVID, but it's also true for some of these newer data sets, these behavioral data sets. It's really important to get the technical parts right. And then data sharing. I think we've seen a really an interesting sea change where from January onwards, there are these opportunistic and I think grounded in good intentions approaches of companies to share data. They really want to share data, and policymakers want all the insights, but there's this massive disconnect because like more data isn't always good. The data has to be grounded in a very clear epidemiological goal, and we need to understand how policymakers can use it. And there's a huge heterogeneity in the capacity of policymakers to take in data and use it in a sensible way. And we've seen that everywhere in low and high income settings, where there's this capacity issue on the policy end for policymakers to absorb the information. And it's just not enough to provide data. It has to be analyzed in a way that makes sense for the actual epidemic control goals. So I think over the last 10 years in the research community, there's been quite a lot of work to try and understand how to aggregate the data, how to do this in a sensible way with privacy in place. But it's largely been ad hoc, and it's relied on individual researchers taking responsibility for making the right decision in the context of their IRB, and then making an additional decision about how to share that data. And that is a loosely regulated space, partly because IRBs at universities are often not qualified to even understand the implications of this data or how to manage it in a sensible way. And also because industry has its own incentive structures, of course, and are also not really grounded in a public health environment. So there is not an obvious link between more data and better policy. There has to be this pipeline that involves rigorous analysis. This paper is coming out in Lancet Digital Health. It's just, we're trying to start to put together really systematic approaches to understanding this data so that we can standardize not just the metrics that we use, but also how to communicate uncertainty, what kinds of things data providers need to tell us in order to do sensible approach. And then next, I have one more slide. No, I think I have two more. So again, there are these two types of privacy. I think everyone is well aware of the problems of re-identification of individual data that's not consented to. And of course, we need to protect individual privacy, but I do feel like that's top of mind for many organizations, even though some of them don't go far enough in terms of just hashing IDs. We know now that there's a kind of fingerprint effect where if you have a couple of data points, you can start to re-identify people. That's a problem that can be worked on and has a very active research agenda around it. Group privacy is much more difficult. So I think we have not really started to understand what kinds of aggregation processes can protect groups and what it means to be a vulnerable group in that sense. And so I think group privacy is like the next step for thinking about how we use this data for public health and what kinds of regulations might be needed. Next. And so I just want to go back to this first slide. There's this very concerning blurring of the lines between public health surveillance and state surveillance. And we've seen that start to emerge among data providers in the US and elsewhere, where we're starting to see that this kind of location data is not just useful for public health, but if you can start to understand location mobility patterns, that is going to be used in the context of law enforcement. And I think there's a big concern that without stringent regulations around how this data is used and what kinds of flow are permitted and how that's controlled, that starts to become very problematic. So the relatively patchwork regulatory process that we had in the past for some of these kinds of research activities are now being broken down and bypassed. And that represents something that I think we need action on legislatively and in the kind of industry space. We need to come up with some really agreed upon guidelines. So for example, Facebook has a policy that they don't share data directly with government agencies. But, you know, for example, the ad tech industry is not regulated in that way. And, you know, there is the sense that this data is being shared and monetized in the context of state surveillance. And that undermines not just public trust, which is of course so important for any public health response, but also really how we think about this data in the context of social good and where we want to go with this. So we're really on the cusp of this kinds of information being in the public domain, but also being used for policy purposes. And I think if we don't pause now and think about what guardrails we need to make sure that this is safe, we're on a slippery slope, and it could go either way. It could either move in the direction of not using this data at all in some places, and that would be a shame because it's very helpful, or it'll be a free-for-all, and then we risk people's privacy, and we risk vulnerable groups in particular being targeted even more than they already are. So I will stop there, and I'm happy to discuss whatever aspect you would like.
Caroline, this is absolutely fascinating. Thank you so much for educating us all and giving us a glimpse of your world. I think we don't get that glimpse frequently enough, and nor do regulators for that matter as well. I mean, several things struck me, and thank you for explaining the sea change that is taking place and telling us really we're on the cusp of something that either can go very bad or very good, and we need to seize that moment. Obviously, you talk a lot about aggregate data, anonymous data. Of course, there's a lot of personal data that also needs to be shared. But where we're seeing problems from privacy professionals and community is that different regulators take also different views as to when is data truly anonymized and when is aggregate. And when is it personal data? And so if the data isn't truly anonymized, or they think it isn't, then companies are not going to be sharing data, and they're worried about that. So there's this reticence risk, and I think we should be discussing this in the panelist session. And I like your point about armchair epidemiologists. I think we have lots of armchair privacy experts, and thank you for reminding us that actually data analytics is a science. And an art, and something that has to be done by experts, and not every data is as useful as people who do analytics claim it to be. So it's something that I think industry has to also understand, but regulators and especially governments. Thank you for reminding us about the creep of the government surveillance. I think this is something that we all understand in this world, and we want to make sure that when we allow this use of data, there are some safety net of privacy to go back. And I have actually a question to you, a immediate follow-up question. You talk a lot about we need to do something, and it seems that people who need to do something are in different silos: academia, researchers, companies who are sitting on the data. Many of them are good, but you talk about some who are not doing the right thing, regulators who are here, some policymakers who are, some are here, some are not here, some are in different regulators as well, as you have said, and us privacy professionals. So what is that for? Where can we kind of talk together? Is there sort of an equivalent of public health organizations or you researchers, sitting together at global level where the Global Privacy Assembly can actually engage with you? Does something like that exist?
Yeah, I think this is one of the problems actually, that we don't have a common forum, and because it's these, lots of bilateral relationships, the bigger picture can get lost. And as you say, there is so much heterogeneity between countries, even in how they think about things, and then you have corporate entities that are, international, and the international frameworks that the GSMA came up with some guidelines actually around Ebola, but there isn't a kind of clear, obvious forum for this discussion. And one thing I should mention is that the National Academy of Sciences will be convening a workshop on this with the goal of thinking about how to lay out the frameworks, the legislative, regulatory frameworks to make sense of this. I think one of the big issues here is that because the science itself is not, it's not straightforward, and so there's a whole field of research that needs to happen, and because people are not used to this kind of data, in each one of the silos, there can be misunderstandings about what anonymization means and what the whole point is. And so without that big picture of the whole pipeline, with everyone kind of able to say what their piece of that pipeline is, it's really hard to come up with frameworks that are coherent. So I think that's a gap. This National Academy Sciences group hopefully will start to fill some of the technical aspects and think through that. But I think that there is a need for a more global conversation on this.
Well, we will continue that. And of course, everybody, please think about your questions and comments, and of course our other panelists will be commenting on Caroline, your keynote, and we'll have a chance to convene again at the end through our panel. So thank you very much for that, Caroline. Again, absolutely fascinating, huge eye-opener, I think, for all. Now let's move on to hear from our regulators. We have got a group of three fabulous regulators, data protection regulators from different parts of the world. Zikin Young, who is the Associate Chief Executive at Singapore, PDPC, Gregory Smolinas, who is Deputy Privacy Commissioner at the Office of Privacy Commissioner of Canada, and Wojciech Wiewiorowski, EDPS, European Data Protection Supervisor. All of you have been working in this field, so we really want to hear from you. What have you learned from this pandemic, and perhaps some of the outlook for the future? So Zikin, can we start with you, please? You've been hugely active. I think the first contact tracing app, probably successful one, was in Singapore. So tell us your pearls of wisdom that you can share.
Yeah, thank you. I'm not sure whether pearls of wisdom, but I'll be glad to share what little we know, right? And perhaps what I'll do is maybe I would start off with a bit of crystal ball gazing, and really talk to the point about how with rapid digitalization and the digital acceleration, how data protection authorities need to kind of like rethink, regroup, right, and relook the way we are implementing data, administering and enforcing data protection regulations, right? And then later, the second part of my sharing will be around specifically things that we've done to assist with the contact tracing efforts. So next slide, please. So I think that it is undisputed that COVID-19 has done more for digitalization and acceleration of digitalization than any government CIO, CEO has in recent history, right? And I think that this actually creates a new landscape for data protection regulators, because with more companies going online, a lot of them in the rapid digitalization may not actually have picked up the right habits, right, the right practices to safeguard the new forms of electronic data that they are starting to have access to and they're starting to accumulate. So while safeguarding and protecting is one important component that we need to take a look at, right? But the other thing that's very important as well is that a lot of them may not realize that they are actually sitting on data that, if properly used in the right way, can actually help them in their recovery. Next slide, please. So one of the things that we are looking at and starting to reorientate and think about really is that when you have a marketplace of organizations and private sector businesses that's struggling for survival, when people are out of jobs and we are trying to create employment opportunities across the board so that people can get back to work, right? What is the role of data protection regulators here? Can we contribute to the national efforts of economic recovery, right? And I think that that's one of the key things that as data protection regulators, we need to start thinking about, and we need to start looking again at how we are pushing out the message of data protection to these businesses. Because I think, I firmly believe that the rapid digitalization that we've seen in the last few months is actually a blessing in disguise. It's helped a lot of, especially small and micro enterprises get online, right? So now is really a time of ensuring that we get the right message to them, a message that is simple enough for them to understand and implement. So we have to make sure that our message is pitched at the right level, that they are able to understand, implement very easy and quick to adopt practices within the organizations to protect the data that they have, right? To ensure that they're making use of it in very conscious and careful ways. But at the same time, get them to realize that this data is a bit of a, I wouldn't say treasure trove, but it can be an asset, right? That if they make good use of it, can help them in their recovery, right? And a bit of the navel gazing I have been engaging in the last few weeks, right? Really brought me this idea. We are familiar with the different kinds of obligations or principles in data protection principles. But one thing that I'm starting to think harder about is actually how can we reinterpret the role of the accuracy obligation, the principle of accuracy. We've always, I don't see too much discussion about it, right? But one of the thoughts I have around this really is that we need to spend some time thinking about the importance of accurate data and the importance of encouraging businesses to use the right tools, business intelligence tools, analytics tools, right, to be able to get accurate and the correct insight out of the data that they already have. And how do we translate this accuracy obligation in a way that will resonate with the companies at this point in time who are trying to make good business decisions to invest the legal resources that they have in these dangerous times, so that they are able to get on the road to recovery and stay on the road to recovery. I think a lot of thoughts need to go into this, right? And I hope that we will be able to have some time to discuss about how in this time, right, even as companies need to recover, data protection authorities could actually benefit also from relooking, reinterpreting, and to make sure that some of these principles can be made relevant to the companies. Next slide, please. The next few slides I will very quickly skip through because I think some of us may have attended one of my earlier talks. It's really about the PDPC's role in Singapore in contact tracing, right? Contact tracing in Singapore is done by a centralized system, right, by the Public Health Authority. And looking back, I can see that actually throughout the different phases of this pandemic, the concept of operations for contact tracing changed from phase to phase. It was initial stage where it was we came out with a digital contact tracing tool. We were very fortunate to be invited to participate in the design phase before it was finalized, and we worked with our counterpart, the Government Technology Agency, to embed data protection by design principles, right? Good accountability practices for managing the data before it went live. But as the pandemic got a lot more serious and we approached a lockdown situation, right? Of course, contact tracing efforts continued, but with everyone not moving and staying at home, the scope for that was a little bit reduced. But the key thing was that as we gradually emerged from the circuit breaker or lockdown period, and as more workers were going back to get essential services scaled up, to get business back, right? There was a change in the concept of operations as well, and digital contact tracing became a very important tool in the management of the pandemic to see whether we could open and respond very quickly when we detect early hotspots, right, of clusters, and to try and get to them as quickly as possible. In different phases, the PDPC contributed in different ways. So in the initial part, data protection by design, participating in accountability practices, and as we went to subsequent phases, we supported through the issuance of advisories and making clear to employers their obligation to ensure a safe working environment if they are deploying contact tracing applications through their devices, whether it is BYOD policies that they need to update, or whether it is through their existing IT policies. We also had to provide guidance and assistance to premise owners, right? When the government started rolling out Safe Entry, which is a slightly different tool, right? Think of it as a check-in, check-out tool, right? That were deployed in places where people congregated, supermarkets, wet markets, restaurants, right? So that it was an additional source of information to help the contact tracing efforts. So we implemented and issued advisories to help premise owners and employers understand what they need to do in order to comply with data protection laws, while at the same time putting some of these things in place. Next slide, please. Yes. So in Singapore, I just want to very briefly say that contact tracing is a centralized system carried out by the Public Health Authority, right? And the tools I mentioned, the digital contact tracing tools I've mentioned, are there to assist a human decision maker, a human person who actually calls out the patient. And we have seen the data, right? It has been quite helpful in helping the conversation between the contact tracing center and the patients in assisting the patients to recall who else he has been in close contact with, and to assist, right, in the assessment of whether some of these contacts are actually casual contacts and transient contacts and are therefore lower risk, right? I would say that based on the numbers we've seen, right, it is a very it's a large number, right, of contact tracing close contacts, right, that have been validated or where the digital contact tracing tools have assisted, right, to help speed up, right, the identification of direct contacts, and hence the contact tracing center is able to get that job done very quickly, right? And I think the key thing we need to realize also is that for a dense urban environment like Singapore, right, speed and accuracy is very important, and even half a day, 2 hours, right, delay could result in a close contact himself actually having contact with a few others or a lot more others, and it will actually increase the burden on the contact tracing center. Next slide, please. I will end off with this. So I think I've mentioned and covered this already, that the data that's used is to assist contact tracing, right, through different techniques. I think there's an activity map that they use to assist in the recall. But the other thing that's also important is that the data is also helpful in understanding how clusters are formed and how the virus spreads between clusters. Now, one thing I would mention is that Dr. Baki's talk really talked about mobile data. The kind of data that we use here doesn't include mobile data. The digital contact tracing tool that we use is based on Bluetooth and proximity data. That's a lot more accurate and much more helpful for the kind of contact tracing ops that is run here. And mobile data, I think, is not something that we currently use. Now, so the use of the data is important, not just for contact tracing, but also to see how clusters are spread. Next slide. The final points I want to make before I hand my time over is really to get us to start thinking about what's the next step for data protection authorities for contact tracing and the management of this pandemic. Because I think that as economies recover and as international travel gets back online, what we need to start considering is really to see whether how do we facilitate, right, the exchange of data or a collaboration, right, for contact tracing efforts for international travelers, to see so that we can assist, right, the recovery of our economy. So thank you very much for the opportunity to share, and I look forward to the Q&A later.
Thank you very much, Zikin, and thank you for reminding us about the need to look at some of these data protection principles and be courageous again in how you interpret them. And I'm going to, in fact, ask all the other data protection authorities to also give their view as to where we need to tweak, right? This is about data protection reimagined. Where do we need to tweak and reinterpret our existing principles to enable some of this positive data sharing? International data flows, of course, very important as well. So we'll come to that in the panel discussion. Can I ask now Gregory Smolinec to take the floor and give us his perspective from Canada? And Gregory, tell us also your view on did you in Canada have to reimagine some of your data protection principles as an OPC as well?
Sure, I'll give you some thoughts on that as well. Hello, everybody. Thank you, first of all, for inviting me to this webinar. My name is Gregory Smolinec. I've been Deputy Commissioner for Policy and Promotion at the Office of the Privacy Commissioner of Canada for 2 years. I'd like to share some thoughts with you on the pandemic and the future, and what I believe is fundamentally at stake. For years, the strategic environment for data protection authorities around the world has been evolving, and it's been evolving fast. Just look at the speed of technological change and changes, for instance, in business models. The pandemic has, of course, accelerated this already fast pace of change. And this acceleration has affected privacy in myriad ways and serves to underline risks to the human right of privacy and other rights and freedoms for which privacy is an instrumental precondition. In times of emergency, such as a pandemic, we need to strengthen respect for human rights, including privacy, rather than seek ways to curtail human rights or to speculate on whether individuals are prepared to curtail their rights. In response to the pandemic, the OPC has, for your information, and partially in response to Boyana's question, adopted a philosophy of flexibility and contextuality. This means that while the privacy laws still apply, we as a regulator have indicated that we are sensitive to the pandemic context and will be flexible. We've also developed guidance and a framework to assist the Canadian government in quickly implementing new initiatives in privacy protective ways, and we've offered advisory services in a massive way to help along with these initiatives. In addition, we've also systematically examined federal, provincial, and territorial privacy laws and emergency orders across the country to see whether there is any credence to the notion that these laws inhibit the sharing of health information that could otherwise be used to counter the effects of the pandemic. We have also discussed this topic with experts in health information. Our conclusion is basically no, our privacy statutes are not a barrier to sharing information in the pandemic context, or for that matter, to the conduct of research. And that's not to say that there are no hurdles or barriers. They do exist. They just don't exist in privacy law in Canada. Instead, they arise from different sources, imperfect, ever-changing technologies, new systems, new software, new platforms, new devices. They arise from changing vendors and suppliers, shifting technical standards, new lines of businesses, different obligations between contractual parties. They also stem from varied appetites for or aversions to risk at different institutional and governmental levels. They also come from differing bureaucratic and corporate cultures. Now, we need to know, I believe, that privacy laws actually do protect us as individuals, as opposed to somehow imperiling us. In addition, we need to get trust, transparency, ethics, and oversight in place around privacy questions before new programs and data sharing unfolds. As custodians of data, custodians of data need to understand when and how they can and should share for research and public health purposes. And this requires addressing reticence problems through training and education. Now, as for the meaning of the pandemic, they are, of course, multiple and they are profound. The human cost of the pandemic itself has been immense, with pain, suffering, and death around the world. The pandemic has also affected human behavior and psychology on both individual and societal levels. Then there are the pandemic's extraordinary effects on the economy, on commerce, on education, medicine, politics, international affairs. Some of these will no doubt be long-lasting, and each of these things will have knock-on effects, indeed profound ones, on privacy. But perhaps the most obvious thing is, as I mentioned, the accelerated digitization in the context of the pandemic. Upon reflection, it's evident that we are witnessing developments that amount to an unfolding history in which communications, and more precisely communications technology, is central to epochal social change and to the place of the individual in society. Our challenge is to understand these historical developments, to be able to describe them in sufficient detail so we can see the broader picture that emerges. So what are we dealing with here? The great Canadian communications theorist Marshall McLuhan provides some insight into this question. He held that new technologies exert a gravitational effect on cognition, which in turn affects social organization. In McLuhan's analysis, for instance, print technology changed human perceptual habits and social interactions, making possible the most salient trends of the modern period, including individualism, democracy, Protestantism, capitalism, and nationalism. What effects then do digital communications technologies have? What has the internet, the smartphone, and more recently, let's say, exposure notification apps wrought on humankind? Let's go once again to McLuhan and ask, what are the media effects of, say, a prototypical pandemic health app? What does the app enhance? What does the medium make obsolete? What is the medium retrieved and that had been rendered obsolete earlier? And what can an app flip into and push to its extremes? One partial answer I can discern in response to these questions is the question of obsolescence, and that is that we seem to be witnessing some decentering of government as the authoritative source of public health advice. Now, as for privacy per se, as this audience is fully aware, contemporary privacy law is supposed to carry with it certain obligations for organizations and to provide certain rights to individuals. Ultimately, that's because people have a right to understand how information about their person is processed, by whom, and for what reasons. Furthermore, beyond a right to an explanation of how their information is used and shared, people have a right to demand accountability. They have a right to lodge a complaint, to challenge organizations involved. Ultimately, they have a right to choose freely and with meaningful consent, free of coercion. The problem is that the recourse to technological fixes for complex and urgent problems can, in some cases, complicate how individuals exercise their rights. Indeed, mobilizing high-tech systems and global digital networks can magnify existing problems, create new data security risks, for instance. We could exclude vulnerable populations and create, in the process, new inequities. Now, none of this is a particularly new diagnosis. Let me make, in addition, 4 high-level observations as we try to reframe our data protection challenges. First, we have to acknowledge the enormous pressures governments are under worldwide to mount a response. Many public authorities have been overwhelmed and in some cases seriously unprepared. We're witnessing now a shift in resources and responsibilities from government organizations to commercial or even sometimes personal systems. And we can cross-reference this point with the observation regarding the decentering or marginalization of government. To put it bluntly, that is what a downloadable pandemic health app is at the end of the day. Government downloading, literally, a core public health function to a phone. Beyond that shift from public responsibility to an individual's private technology, my second point is about the inherent ethereal quality of the scheme. For most users of such apps, the processing is effectively invisible. Like the virus it's meant to counter, the solution too is invisible. And I would add, it may also be equally poorly understood. That brings me to a third point, namely that data-driven public health programs may flounder on the inscrutability of the technology to many users. Why? Because the underlying API, technical device specs, and software coding for this approach will be largely incomprehensible to most users. At best, instead, we have an amorphous, arm's length, at 3 removed sort of government intervention known as nudging. And that brings me to the fourth point. That is that this digital solution may affect the well-being, economic opportunities, and liberty of millions of individuals if they're lucky enough to have a high-end smartphone. But where does that leave everyone else? I realize all of this sounds somewhat critical, and I can see that it's far too early to probe the impacts of a new digital technology and smartphones of millions of people. What it will be is maybe unknown, so nothing essentially is written. But McLuhan summed up a key risk in one line, and I quote, "Electronic environments are invisible architectures, and their ground rules, pervasive structures, and overall patterns elude all easy perception." I worry that this characterizes the reimagined city before us. We're driving towards a collective area where we do not see the walls, or the guardrails, or the danger zones. The pervasive structures may be eluding our perception, but we have to look for them. We must discern them in the haze. We need to think critically about massively complex policy problems and technological solutions that may not adequately address the scale of the challenges. There's no substitute for strategy in which ends, ways, and means are designed in proportion to each other and are adequate to the meaning and scale of the problem at hand. Sometimes, when we turn to apps and phones as the go-to solution, the technology can end up delimiting the scope of the problem, sometimes prematurely. I think defining all public policy challenges as data problems or remediable by narrow technological solutions pushes other issues off the stage. Issues like fulsome strategy formulation, scientific rigor and creativity leading to new knowledge, public health accountability, the mobilization of society towards achieving common goals, proven effectiveness, minimal intrusion, to say nothing of equity, accessibility, and fairness. All technologies have the potential to act as accelerants when a society is already in a state of crisis. And we can be blunt here. Many democracies were already in crisis before the pandemic struck, with various media affecting individuals, society, social values, and the character of our democracies. Trust was already a much depleted resource. Therefore, to conclude, I think the current responses globally to COVID-19 are plainly highlighting both the potential of technology for public good, as well as effects, perhaps yet poorly understood effects on individuals and society. In our digitized circumstances then, to effectively protect individuals' privacy as a human right, we must also push for technology to be explicable, transparent, distributed, and effective. So I make an appeal here to governments. One, for careful planning and to fill the strategy gap. And an appeal for thoughtful information sharing and public health responses that are fair, equitable, transparent, reasonable, and proportional. The first and most basic question is, what ends do we seek? For people and for society. Life? Yes, of course. And simultaneously, what kind of life? If somewhere in the answers to this question, we say free and fair and democratic, then privacy is essential. The future of our medical systems, how we deliver medicine, how we learn, how we interact and travel and trade and govern ourselves will all be shaped for years to come by how we deal with these issues and risks that we've just discussed. Thanks again for the invitation, and thanks for your attention. I look forward to the discussion.
Gregory, thank you so much, and thank you for taking us a little bit on the history lane and reminding us of the sort of what kind of important moment we live in. And I think I like very much your point. There is no substitute for strategy. I think all of us have to be much more strategic, not just governments, but I think we as regulators and we as organizations as well. I think there are lots of questions that arise from your discussion, but let's leave that for the panel. And if I can ask Wojciech Wiewiorowski, I can see you, Wojciech, to please give us your opinion. Oh, I lost you on the video. Maybe you can put on the video again. Just give us your view. Oh, I can see you now. Good. Give us your view of what has it been to be the European Data Protection Supervisor, to herd all these member states, to hopefully try to do things better as well as all the institutions. And has GDPR passed the stress test of COVID?
Thank you, Bojana, for inviting me here. Thank you for the possibility to talk with you and to give you a little bit of flavor of the European discussion, which was connected with the data protection authorities, supervisory authorities, and their role during the COVID crisis. First of all, I have to say that while I'm the European Data Protection Supervisor, I'm not representing all the data protection authorities in Europe. They are, of course, cooperating in the European Data Protection Board. And the things which I will say here will be reflecting the discussion that we have in EDPB, in the European Data Protection Board, but not necessarily will present the opinion of all the data protection authorities from Europe, especially in the second part of my short intervention. In the first part, I'm going to tell you a few words about our experiences and the follow-up that we want to have after the whole crisis. And in the second part, I will try to address the keynote that we had here and Dr. Baki and her presentation on the new ways of dealing with the big data issues. Well, starting from the experiences of the European data protection authorities, we can say that we have found all the differences that exist in Europe, and we have found all the similarities and all the possibilities for synergy in our activities in these few months. Just to tell you about the level of the cooperation between the data protection authorities, I will tell you that instead of having one meeting of the European Data Protection Board a month, for a long time we had 2 meetings of European Data Protection Board a week. So every Tuesday and Friday, all the data protection authorities from all over Europe were meeting online and discussing the next steps they are going to make. So we found out that with all the differences that we may find in Europe, the most important thing is to talk, to discuss, to try to find the solutions all together. Of course, when I say that the countries are differing one from another, that first of all means that the problems and the challenges might be absolutely different as Germany is from Luxembourg. So the answers that are given in the federal state of 16 entities, plus the federal government, having the distribution of different roles in the country, but also having 60 million inhabitants, is different from the tiny little country like Luxembourg in the middle of Europe, with the borders with several countries, with the possibility to move and the necessity to move the people in cross-border. So if you're leaving your town, you're almost leaving your country. So the second example of the differences between the big countries and the small countries is that when it came to the answers from the IT industry it meant different thing to have this answer in the country which is 60 million inhabitants, and different answer where the country is 250,000 people in. So, for example, there is unnamed, I'm not going to name the country, there was a country where the IT company that was going to prepare the application for the contract tracing was the same company which was dealing with DNA resources of all the population in this country, because that was simply the only good, big enough company to take this challenge of creating an application for this nation. So the challenges may differ. The answers should be more or less similar. The second thing which we learned very soon after the start of the crisis is that we have to learn. We as the data protection authorities. Of course, each of us had somebody responsible for health, for public health in the institution. Even the smallest data protection authorities had a case officer that was dealing with the health issues. But suddenly, we had to understand all epidemiology. We had to understand the language they use. And the example which I'm always repeating is that the word surveillance, which has a very bad connotation in the privacy society, is an absolutely normal word in epidemiology. And this is simply a tool. The surveillance is a tool to be used in order to help the people. While for the supervisory authorities and for the data protection activists and data protection workers, case officers in the data protection authorities, that was something which was scary by definition. So we had to learn the language, we had to learn the new field of knowledge, we had to learn the procedures, we had to learn the ways of doing the things in this sector rapidly. And there was no time for training. This training has to be done immediately. So the possibility to get the knowledge, the possibility to acquire the knowledge was one of the things which is definitely one of our challenge. And the other problem that we find is the efficiency. So how efficient we can be with our answers. And here, let me just give you the point of view of one of the authority, which I am as the European Data Protection Supervisor. There were several situations in which we were able to give an answer in hours or in day or in 2 days to the questions that were asked by the institutions. And we thought that we are very efficient and we work very rapidly. While at the same time, there were at least 2 questions that were asked to us by the institutions where we actually failed. Meaning we found out that there are so many opinions inside the Data Protection Authority that finding our common answer as the institution was actually impossible in the short term. Well, of course, I understand it as a kind of failure from us. Also failure from me personally as being the one-person body, and I should be the one who will give the answer immediately, and I was not able to do it. So these are the things that we have to study. These are the things that we have to repeat. And now the last thing, which was a challenge for the data protection authorities and which has not been pointed by my Singaporean and Canadian colleagues, because I agree with most of the things that they said, or all the things that they said. That was the fact that the acceleration meant also that some of the institutions, some of the organizations made a step that they knew is too fast. Meaning they took the risk to implement the solution which they had doubts about, and they knew that the Data Protection Authority will have a doubt about, but they said, well, we have to. We have to, in order to allow our organization to continue work, we have to do something which we have doubts ourselves. We didn't do the data protection impact assessment, and we understand that we can be challenged by the Data Protection Authority, but there is no way this is the high risk situation, and we have to go there. So these are the things which I would add to the presentation of my colleagues. And let me then react a little bit, as probably the first part of the discussion, which we'll have in a while, to the keynote speech that we had at the beginning of this conference. Well, I know that I will be gloomy, I will be grumbling, grinding, whining, complaining, and bothering. But I have to say that while as the scientist, as the person from academia, I fully understand the approach that is taken, and I can see the long-time goals of the activities which were presented by Dr. Baki, and I think that might be very interesting. I'm not surprised that there was no good translation of this data and these studies and these researches into the political decisions or into the tools that might be used against COVID. There was a problem with it because we didn't know what is the purpose that we want to achieve. This is not the complaint against the scientists, this is not complaint against researchers, not even against those who are collecting the data and transmitting this data, but this is the pure fact. We don't know what we will find with this data. Well, I know that there was 3 minutes presentation of the very long studies, but what was surprising out of the results that we got and that you presented here about the mobility of the people, what were the added value of that in comparison with observing how the streets look like and how the consumption of energy generally looks like in the cities. Well, of course, this is a lot of effort that was done in order to collect the data, to anonymize the data, to aggregate the data, and to get the results which actually were known even at the beginning. So while I understand that we start some process of researches because we have an interesting data around, we should not build the expectations according to that. We should not build the expectation that it helps because we don't know if it helps. It reminds me of the situation, all the situations where we are doing the researches during the disaster time. There were enormous studies, wonderful studies that were done during the Second World War for all the disasters that happened during this wartime period. And for example, the research on hunger have been developed a lot during this war, but they were not fighting with hunger. That was simply observing the data which is appearing at this time. So let's not build the expectation in the society that this kind of works will give immediate effect, or if they even give the effect in the second wave of the possible COVID-19 pandemic. Because if we do so, then our tools that we are preparing, for example, the contact tracing apps, will be challenged with its expectations, while we know that they are not the silver bullet anyway. Okay, I'm not going to speak too long. I know that we are behind the schedule, so that would be this initial intervention from me. Thank you.